The governor has lowered the age to 65 for folks that can get the vaccine. Will that be kicking off at the fairgrounds on Monday? That's what everyone's asking.
Yes, we will be able to vaccinate folks over age 65 starting Monday as per the governor's directive. The challenging part is that we've expanded the criteria, but we do not have an expanded pool or amount of vaccine available. So we're still on the same amount of vaccine, maybe a modest increase. So we will be vaccinating as quickly and efficiently as we can, but at present we do not have, enough vaccine anywhere in the country. So we're still on modest.
Pardon me, Dr. John, it sounds to me like you're saying in reference to the governor's rule yesterday and the governor's announcement, maybe not such a good idea, or am I reading between the lines?
I think it's okay. It's a very tough call, but it's okay. We want to get vaccine out as quickly as we can. That's the number one goal. Vaccine saves lives. Every 100 doses we give, we're saving 4 or 5 lives in this age group. So I definitely am not opposed to it, but I just want folks to realize that, the vaccine supply is still limited.
Doc, there are other groups that were also included, but not teachers. Were you surprised by that?
No, again, it's still about a supply issue, and we can expand a little bit, but if we don't have a better supply, we're not going to be able to take, everybody that wants vaccine. There are hundreds of thousands of people who want vaccine. So teachers, we know, are kept safe by the routine methods that we're using in the schools currently in our state, and their risk is, based on being a teacher, is not any higher than that of the general population based on what we've seen over the past year.
We had asked Dr. Martha yesterday, so it's expanded to 65 now. At this point yesterday morning, the governor hadn't made the announcement yet, but now that he has, is the logic, if you will, of the governor's decision, because Louisiana is doing such a great job inoculating 75 and older, and so many of them have been taken care of, and or the vaccine's available. You just said it wasn't. I'm trying to get into the governor's head here and the minds of the people who advised him. Can you help us do that?
I think that, as the governor said in his directive yesterday, or his press conference yesterday, the data is clear that the risk goes up around, age 65. And so we've just aligned what we're doing in Louisiana with what, 50% of the states across the country are doing, using age 65 as the lowest eligibility at this point.
So what's the protocol? Is it pre-registration once again, like the early days of 75 and older? What do you recommend people do? What's the plan?
Anybody who's already registered with us and now meets the criteria, we'll be sending out scheduling emails based on our vaccine supply over the next several days. And those will come out this weekend, but we have appointments already booked for Monday and Tuesday, and I have to very closely balance our vaccine supply with the number of people we schedule, because the last thing I want to do is schedule people and then have to unschedule them, because that makes them very unhappy. I understand it.
There's some misunderstanding. Dr. White told us yesterday that Louisiana has used 90% of the vaccine we have received, which would put us like number 1 in the nation. Is that accurate?
I don't know about those numbers, Aaron.
But we don't have too much in reserve that we're holding somewhere, do we?
No, not that I'm aware of. I'm in my discussions with Dr. White and the state. We are moving vaccines very, very efficiently and effectively across the state, and so I think the others are looking at us saying, "Well, what's Louisiana doing?" And I can tell you the National Guard leadership came and visited our site at the Fairgrounds yesterday to discuss the logistics of how we're doing what we're doing.
So you'll be at the Fairgrounds. Right now, it will be Monday and Tuesday. Anything beyond that yet?
We have second doses for those, reserved for those who need second doses next week. So they'll come on schedule 20 to 22 days after their first dose. And then for first doses next week, we are anticipating being available at the Fairgrounds Monday, Tuesday, and Wednesday.
Monday, Tuesday, Wednesday from 8 to 3:30, correct?
8 to 4.
Okay, good.